Good day. Today is May 8th, and this is our 10th in a series of town halls. This one's going to be a little different today, but I do want to welcome all of you for being here. We're calling it a retail town hall. My guess is we'll have a good group of folks in here who might not necessarily be in the retail industry, but due to the new phase one order from the governor. So thanks everyone for joining us here today. We really appreciate you being here. My name is Corey Atkins. I'm the Vice President of Public Policy and General Counsel for the Asheville Area Chamber of Commerce. We are hosting these town halls in a series in conjunction with Buncombe County, particularly the Emergency Operations Center. Thank you all for being here. Again, we really appreciate everyone working together, both in the public and private sectors during this time. It's really been it's been uplifting to see the community come together and really what's been a difficult time. And I've enjoyed, and the Chamber's really appreciated seeing everyone working together. If you attended our last retail town hall, I told you that this meeting is more about giving the health department an opportunity to listen to business owners about what your best ideas and practices are around safely conducting business as we move forward. I also told you it's not a time to lobby, and today's not really a time to lobby either about whether or when we should open, but you will get a lot better understanding this time compared to last time, now that we are moving out of the governor's current shutdown order, which ends today, May 8th at 5 p.m., and move into phase one. And we're going to talk about some of those changes here in a moment. We'll hear from Fletcher Tove again, our Public Health Emergency Preparedness Director from Buncombe County. Thanks to Fletcher for joining us. And then we're going to go through basically what we know is and isn't in the current phase one order that will take charge today at 5 p.m. We are recording this session as we have all the other ones, and we please ask that you make use of the chat feature, not the Q&A, but the chat feature to give your input, ask your questions. We will be polling you, so to speak, at certain points. So we ask that you put all of that in the chat feature, as we are creating transcripts from these and frequently asked question documents from the chat feature of these town halls and providing those to the county. So there'll be a record of this as well. And we ask that you use that feature going forward. I really want to get started with thanking everyone for your patience at this point. I know people are very anxious during this time, really concerned. We saw that the U.S. unemployment number came out today at almost 15%. And these are anxious times, but we do think, using public safety measures properly in place and protocols, we can begin to slowly reopen. And we're going to talk about how we're going to do that today. And with that, I will introduce Fletcher Tove, who I said is the Buncombe County Public Health Emergency Preparedness Director. And we're going to go through these systematically. First, the phase one reopenings, and then we'll get a little bit more into definitions as well as what your questions and barriers are going forward. So Fletcher, the floor is yours, and thanks again for joining us.
Yeah, you're welcome. Good morning, everyone. Glad to be here working through this with everyone. I think we spoke last week, we were still anticipating phase one, weren't sure the specifics, but had a general idea where we thought it would go. With the governor signing his executive order 138 into effect this week, and then us in Buncombe County aligning with that yesterday. So today at 5 p.m., we enter phase one of reopening for the state of North Carolina and Buncombe County. So see on the screen right now some general differences between what we were at kind of like phase zero through today and what phase one looks like going forward. Really the biggest difference and what affects you guys the most is that going to phase one allows for general retail to open up pretty much across the board, with some specific exceptions for close contact services. But in the past, we're talking about whether you're essential or non-essential. What this order does is kind of move us past that vocabulary. So we're not talking about essential businesses or non-essential businesses anymore. We're just talking about businesses that can be open under phase one and businesses that can't. The restrictions for those businesses, so you guys can operate up to 50% of your fire capacity, as long as you can maintain social, physical distancing guidelines of 6 feet to the greatest extent possible. and you observe sanitation and hygiene practices from public health. Some other changes, mass gathering guidance remains at 10-person people, but the governor made it clear that you can be outside with groups of 10 as well. I know as you guys open, a lot of you guys have kids, so part of this order also encourages childcare centers to reopen for the general public again. Some of them were, more focused on essential workers previously, but now they're officially open to general public. For some of you guys and your staff who might need childcare as you guys look to reopen. Restaurants still closed. All of those close contact services, barbershops, salons, nail studios, where the service delivery is dependent on being in close contact with people, remain closed. And now you can see the rest of the stuff in that chart. Go ahead and take us to the next slide. So, like I said, this goes into effect at 5 p.m. today. Yeah, so one of the things the state's pushing and we're echoing is the 3 W's. So as you guys leave your homes, so we're still at a stay-at-home order, meaning if you're don't have a specific need or urgency, we're still asking you to stay at home as much as possible. But the variety of reasons you're allowed to leave your home now are greatly expanded. So it's not just for those essential purposes, but now you can go out to engage in commercial activity, go into retail stores, go into any business that's open. But we're asking when you're not back and forth, that you stay home as much as possible. Still in the midst of a global pandemic, still a large threat of COVID-19 out there in North Carolina, but we just think we have the steps in place to mitigate it right now. So the 3 W's, if you're out, wear a cloth face covering, particularly if you're in a place where you're going to be within 6 feet of other people and you can't consistently maintain that 6 feet of distance. Wait at least 6 feet apart and avoid close contact. So if you're checking out at one of these retail places or you have staff and clients coming in and out, you need to be marking off 6-foot intervals for people at like checkout counters or any place where people would congregate. And then washing your hands and using hand sanitizer. We've been adding a couple more W's to that list. We also have wipe. So we're wiping down high contact surfaces with increased frequency, and wave. So, we're still not shaking hands. We're still trying not to hug. We're just waving from a 6-foot distance. Go ahead and we can go to the next slide. So to get into now some specific requirements that the governor outlined. So everyone needs to maintain 6 feet apart to the greatest extent possible. You guys, retail is required by this order to do a daily symptom screening of staff. If you go to, I'm sure we'll push this out, but also on buncombecounty.org, we've developed a template screening tool for everyone to use and a screening log to keep for your staff. You don't have to use ours, but you have to do something. So we just want to provide that resource. So as you do those, you have to keep the documentation of that. So you have to establish some way to screen your staff on a daily basis and then keep that documentation. You have to have a plan. So if somebody's at work and develops symptoms, like you're in the middle of a work day, somebody starts coughing, starts feeling feverish, you have to have a plan how you're going to isolate them quickly and send them home immediately. If anybody ever does report symptomatic, remember it's more than just a fever. Fever is just a small component. It's a list of symptoms. But if anybody's symptomatic, you need to be sending them home. Have an HR plan of how you accommodate that. Try to be more flexible with your sick hours. Be more accommodating for people as we look to reopen. Customers, occupancy is not more than 50% of stated fire capacity. There's also somewhere in there it says or 12 people per 1,000 square feet. Or you have to limit if your capacity is greater, but you don't have enough space to keep 6 feet between people, you have to limit to whatever that capacity is so you can maintain 6 feet between customers. Marking 6 feet of spacing at points of sale and high traffic areas. And additionally, if you're having a capacity limit and people are lining up outside, you need to have markings outside so people can stay 6 feet apart. Post signage to remind customers of recommendations. So that's another tool we've developed. That's also on our website at buncombecounty.org. Like a toolkit for retail and all of the businesses. There's signage we've developed. It does a couple things. One, it tells patrons what's expected of them as they come in. Two, it allows you to ensure that patrons know the steps you're taking and being required to take to ensure their safety. And we'll push that out as well. You'll see some of those later in this slide deck. And then provide hand sanitation stations wherever possible, and make sure you have soap water at any sinks and bathrooms. And then perform frequent routine cleaning with approved disinfectants. We have a resource of the EPA approved disinfectants for COVID-19. And so these are all requirements in the order for retail that you must meet to reopen. I think the next slide gets us to this. So now those are requirements. Now we're getting to looking at some recommendations. So a little bit different language, but still best practices. The governor just didn't stipulate that you have to meet these, but provide designated times for seniors and other high-risk populations. So, we have a list of health concerns that put you in a high-risk category or 65 and older. So if it is suitable for your retail, like set aside hours in the morning that are just for that population. Develop and use symptoms that allow, or systems, so you can do online, email, or phone ordering, just trying to limit contact. So if you do curbside pickup, recommend that. If you have delivery options or contact-free checkout, that's great. One caveat there, as you guys open, contactless payment is great. Some people have the cell phone or watch taps or contactless cards or just can swipe, but we encourage that, but we still always need to try to allow for people to use cash. Some people don't have the resources or the banking contacts or the fancy phones to be able to do that kind of remote purchasing. So please always try to have an avenue for people who don't have those same resources to interact and make exchanges in cash. High volume retail, such as grocery stores and pharmacies, where you have like that high volume people coming into either a checkout or other section. It's recommended to use some kind of acrylic or plastic shield, like a plexiglass or something, at the registers as a barrier, like a sneeze guard you'd see like at a buffet, basically. Clearly mark designated entry and exit points, and provide routing assistance through aisles. So this means you might have seen some grocery stores where there's one directions up and down the aisles. If your store is big enough you might need to do that, or have a flow drawn out for people. Please consider doing that. When we talk about limiting access and exits from a store, some of you brought that up in the previous town halls. That was part of your plan. That's a really good idea. So you can monitor how they know one place for people to come in and one place for people to exit. It's good. We just want to ensure that as you do that, we're not physically barring any doors or exits against fire code and going to be potentially trapping people in. So if you need to close off doors, please just tape them off or use signage. Don't actually physically bar or blockade any doors. That could be really dangerous. Next slide. And then just want to touch into some common questions we received a lot via the previous town halls. So the difference between a face covering and a mask and a respirator. So we've been very deliberate over the last couple of weeks of shifting our language that we're pushing as public health. So when we say mask, we're talking about it's like a surgical ear loop mask or a respirator, N95 respirator mask. When we talk about cloth face coverings, that could be something like a bandana. It could be, those sports, what are you called? Like gaiters for your neck. It could be those hand stitch ones we've seen. It could be a folded t-shirt. So we're really trying to get people to do cloth face coverings versus masks as much as possible. A couple of reasons for that. One, there's still scarcity issues and supply chain issues for true medical grade PPE, such as N95s or the surgical grade ear loop masks. If you have those and you can get them, you're free to use them. We're just encouraging people to use face coverings so we can conserve those for first responders and medical personnel. The benefits of a face covering, a cloth face covering, is that you can wash them and reuse them. So if you have two, you can use one for a day, wash it, use the other one the next day, and have those for weeks and months and for the duration of this event, as opposed to the medical grade ones where you could use maybe a week at a time before they start to degrade and lose their form and integrity. Can your business require face coverings? So in the governor's language and our language, it's a strong recommendation to use face coverings without in public. There's no mandate to do so. But as an independent business, you guys have the prerogative to require people entering your store to wear a mask. It's up to you. Our language kind of reflects that, and you can cite that. In addition, we have the limits on capacity, and for your stores, it might end up, if you do the math, you maybe say your capacity could be 20 people, but you're not comfortable with that. You only want to allow 10 people at a time in the store. You have that right to be more restrictive than our guidance. You just can't be less restrictive. So you're free to do that. Public health will support you in those decisions, but we're just not going to mandate face coverings or mandate more than the governor a specific capacity for your stores. Communications, you can see an example of one of the ones we're pushing out on the right, the Stay Safe, Stay Local campaign. I know there's some other campaigns going on from the actual Go Local campaign and some other groups in town. So you see variations of this, but we just want to push one that was more broader to Buncombe County community as a whole, as a resource, because you are mandated to have some sort of signage for the order and this meets those requirements. And for screenings, again, the checklist and the log are at buncombecounty.org. You get that at the website that I discussed. You don't have to use that one, but you do have to use some screening tool on a daily basis for your staff and document it. So that's that resource there. Other resources, the Asheville Chamber there at the coronavirus page is a really great toolkit for businesses for cleaning information, disinfectant information, some general literature and signage, and also just general guidance for different business sectors. And then phase one, so there's still a stay-at-home order, as I said, but there's more reasons you can leave home. I think that's as far as my slides go. If you want to go to the next slide. Yeah, I'll turn it over to you, Corey.
Yeah, I'll give you a little
I'll take questions later.
Yeah, that was a lot of information in a short period of time, and appreciate you walking everyone through all of that. And I know we already had a few questions. I think you answered most of those once the presentation moved on, as far as denying someone service, the posted capacity. There's measurements and metrics you have to use for that. Will the presentation be available? Yes, it'll be available on that same ashevillechamber.org /coronavirus website that we discussed earlier. So now what I really want everyone to do is think about, what is your number one thing? I know there might be more than one. It could be a group of things, I guess, if it's PPE. But what is your number one primary obstacle in reopening? And I want, basically, this isn't scientific, but we want everyone to just in the chat feature so that we can scroll and have a record of it as to what your number one obstacle is to reopening right now. So we really encourage everyone to do that in the chat function, as Fletcher and I maybe talk about some of these other questions that we've had. I would say as an attorney, my strong recommendation is now's the better time than ever to update your employment manual and policy and procedures, because that not only helps you get in compliance with the governor's order and county's order, but also gives you a policy to go back on. So make sure you utilize these resources and the information that we're giving you and that are in these orders, to take that time to make sure that you have your manuals up to date and that they're reflecting this information, so that you're protecting yourself and your employees. Now's as good a time as any. So I'm gonna give a plug for doing that, certainly. Let's see. Rob asked if there's a place to go to download the signage or visuals. That's the Buncombe County website that Fletcher mentioned, is buncombecounty.org /COVID-19. Is that right, Fletcher? I believe that's where all the signs are, like the examples that you saw.
Yeah, you can do that, and also buncombeready.org will take you there as well.
Okay. So we see a lot of health concerns, feeling safe about opening too early. That's a common thing.
You just want me to hop in on some of these, Corey?
Yeah, sure, go for it.
Yeah, so you covered the signage. I saw a question about people handling merchandise in the store. So depending on what kind of retail you are, you might really consider limiting people from handling merchandise. I know we've had some questions from some boutiques and stuff, whether they can allow people to try stuff on. So you might want to consider some kind of protocol about how that's done. Maybe if there's, you have some kind of objects that people are handling and looking at, maybe have a plan for how you wipe those down in between that, or, increase the frequency of your counter space and merchandise wipe downs. We haven't seen any guidance on like letting people try and close, but if you can avoid that, that might be a best practice. I see a lot of questions about, whether it's safe or not to reopen and whether there's a risk involved. So we know that as the state starts to reopen, we will see more positive cases. We'll see somewhat of an increased spread. We know locally we've seen more increased cases, but a lot of that is due because we're doing a lot more testing than we were even 2 or 3 weeks ago. But I think what we're looking at several different data trends and metrics. One of the things we looked at is the governor's roadmap to ready, this 3-pronged approach. Those prongs are increased testing, capacity for contact tracing, and downward positive trends. So we know slowly but surely we're increasing our capacity for testing in Buncombe County. We know for current state guidance, we have more than enough capacity right now to do all the testing that needs to be done. And that's because that's only based right now for symptomatic persons. We know for contact tracing, Buncombe County is hitting 100% contact on our contact tracing. So we're doing really well with that. And we have capacities we could do far beyond. If we do see a big surge in cases, we could do much more contact tracing. So we feel really good about our local contact tracing capacity. And then downward trends. We are seeing more cases, but we also know we're doing a lot more testing. And so when we look at number of new positive cases as a ratio of the number of new tests, we see a pretty good flat plateau. So that's pretty good. We also know that our hospital census, the number of ICU beds, is very low, which is a good sign for us. So that means we have a whole bunch of healthcare capacity. And that's really the big concern, is that we get to a point where we overwhelm our healthcare systems. So we're looking really good there. So what we're doing and the state's doing is doing this first phase, give us a 2-week period to assess, see what the trends do, and make an assessment from there. It's very possible the governor might extend phase 1 by a week or 2, depending on the numbers. But we feel like phase 1 is an appropriate step right now. You guys can make, if you don't feel comfortable opening, that's your decision. Like it's just, we're opening the door so that you can make the decision. It's not the government necessarily making the decision there.
Yeah, like Fletcher said, I mean, the initial thought is this will go to May 22nd, but there is definitely an opening for it to go longer. And I would just encourage everyone to stay on top of the data, stay on top of the information coming from the state and from the county. Make sure you're up to date on that. But at the end of the day, as far as concern, I see a lot of concern over customers coming back. And even if you reopen, is it going to be worth the risk? We really have to communicate as a community and take all this information, all the signage, all the visual aids, and make sure we're all in it and communicating that if you do feel safe to come out as an individual and you're not at high risk or anything, then you've done all the things in your business to make sure that you're following protocols, that social distancing is being practiced, that you're cleaning regularly. So I would just encourage, communication is key, and now's as good a time as any, again, to make sure you're on top of all the social media landscape, that you are really pushing out as much information as you can, and passing that along, because I think it's going to take a groundswell. It's going to take a grassroots effort, just like everything else we do in Asheville. So in Buncombe County. So I would really encourage you to make sure you continue to do that.
I see some people asking about resources for sanitizer and other stuff. So I see some people have posted that H&H Distillery locally is producing and selling sanitizer. There's also, see some people, NOAA, sharing that supplyconnector.org is a local supplier of PPE resources. I These ones last week I was able to keep up and I think answer pretty much every question that popped up. But that chat's going fast and furious right now, so I'm trying to keep up and answer some questions as we go along. Yeah, another one. Cintas is a good provider for hand sanitizer and chemicals. In there. It sounds like Amazon's getting some more, masks type stuff back in their inventory. One thing we're looking at as the county, we're looking at pushing out to some businesses some small quantities potentially of some sort of face covering and masks. We're looking into resourcing that right now. Don't have any good answers yet, but we are looking at ordering like tens of thousands of some kind of face covering and other masks to be able to distribute.
Yeah, we see Oak and Grist Distillery, Cultivated Cocktails have both moved to hand sanitizer production. And then Eric shared that Hands-On Asheville Buncombe is a source for sanitizer, excuse me.
Yeah, that's a good one too. That Hands-On Asheville in-kind donations, you could put if you have something to donate and also if you request for stuff, and they can kind of connect the dots there for some of these resources. Yeah, so a lot of good resources for local hand sanitizer being developed. Yeah, so I see the Grove Arcade question. So we've been in direct discussion with the mall. You guys are a little unique because you have your independent stores and then you have like a concourse or the wings. So the mall is opening Saturday. We had a discussion with them that they let a really precise plan about how they are going to monitor and observe the entrances and exits and they're kind of treating the concourses, I don't know if that's the right word, but the open areas in between stores as a separate space and limiting those as well. So I think that's a good strategy for the Grove Arcade. The stores can have limits, but you also need to set a limits on the concourse in between the stores as well, and monitor those entrances and exits. Maybe tape some of them off so you can have a better insight on who's going in and going out. Like start some people at the north end coming in and make them exit off of one end. Something like that might be a good strategy.
Yeah. Is there an online resource for data and numbers for Asheville? I know the state DHHS has a site, correct? Or is it on the CDC website?
Yeah, no, we have I didn't see that specific question, but we have a really good data tracker now on buncombecounty.org/COVID or buncombeready.org. It's really good graphical. It shows you our case count, our testing counts, our trends compared to the other 10 top metropolitan areas in the state, which are doing really well. I think we're 6 or 7 in size, but we're the lowest of those top 10. It also shows some of the steps we've taken along the way as our case count has changed. But that's a really good resource. You can find it's just I think it's called the data dashboard or case dashboard on buncombecounty.org.
Okay.
Yeah, I know there's been some hand washing stations downtown that the city has looked at, and I think they're looking at a plan to also supplement that with hand sanitation. But I know they have around downtown put a couple of specific hand washing stations in I see Biltmore Village too.
Yeah, I think that would be great if the city or county have those resources and are able to provide them. That makes a lot of sense to me. Let's see, there was a specific question. The web address to get the presentation on the chat will be our website, ashevillechamber.org/coronavirus. And the county is also working on transcripting all of the town halls in both English and Spanish, as I understand it, as well as developing a frequently asked questions document. I'm not 100% sure if those are completed yet, as we've done 10 of these now. But yeah, Ken, so there you see our Desiree coming through as always, put the link to our website on there for you in the chat.
So I see a question about enforcement. I think you're asking about maybe the capacity enforcement. So again, that's probably gonna be complaint driven. If we know of a business that's getting reported for having too many people or something, we're asking people to report that to law enforcement on a non-emergency line. It's up to the discretion of that law enforcement agency how they respond. Primarily, it's just the education point. So they'll go and have a discussion with people. If there's continued violation or resistance, they'll have a deeper conversation, but potentially they could give a citation. But I don't think we've seen that for any business yet. The few instances we have responded, it's just been a conversation about informing them of what the most recent guidance is, and most people have been pretty happy to conform to that.
Right. I think we can go to the next slide. It seems like we've moved past the primary obstacle and really just discussing more along the lines of what's everyone's, what other questions and concerns remain. And we're really, there's tons here. And I know, Fletcher, you're doing your best to get through as many of them as you can. Do you know exactly where on the website the signage is? I think some people are having difficulty finding it, and they won't be able to today.
It should be an article. I'll Tim, if you're listening, can you look at the site and see if you could find that article with the signage? I see some questions about signage so we're telling you guys you can enforce people that have to wear a mask. I see some requests for that we create some additional language in signage that says you guys have the right to enforce that. I'll take that back to our JIC and see if we can make a special signage for that. And if you as a business choose to enforce that and people aren't following that, yes, you can deny them to enter, and you can call the police if they're not complying or becoming aggressive. And I would recommend you do so.
Yes. Yeah.
There. If you look in the chat, Asheville Area Chamber of Commerce just posted the link to that signage. It's going fast.
It is.
Time stamped at 11:35.
Yeah, this is good engagement though. This is what we want. This is why we're doing these.
Yeah. And I see Rachel Ruse asking a question about the city marking space in public areas. So particularly in downtown where there's so many storefronts, we're in discussion with the city right now about just maybe having some kind of strategic plan where they're just going to go ahead and mark out 6-foot intervals. So we're having that discussion about that. So you guys aren't individually figuring it out, but particularly in downtown where there's such a density of businesses.
Mm-hmm. Yeah, I think this is this great interaction and
yeah. I do want to let everyone know this chat's going fast, but we are going to review it. So I apologize if we can't catch all the questions as they pop up, but we'll review it and do a similar kind of FAQ follow-up once we have some time to digest it and work through it.
Yeah.
I've seen a couple of questions about unemployment. I know you guys are kind of battling staffing shortages with people who are getting paid kind of equivalently to stay home on unemployment right now. A little bit out of my wheelhouse, but we have seen that question pop up in pretty much all the town halls we had last week. I don't know if Corey or you have any advice for that.
There's no perfect answer, but there is going to be a limit on those employees' ability to collect that unemployment. Of course, the federal benefit runs out on July 31st, so that additional $600, which probably puts those individuals over the top of that number that you think makes it worthwhile for them to stay unemployed. My guess is the vast majority do want to get back to work, though. I know you might have some difficulty, but I do think that you're still going to have to. I think most people generally want to earn a paycheck. Has always sort of been my belief, but it will run out if you talk to them and encourage them to come back, especially if it's an employee you really value and really want to get back on your staff. I would explain to them that this isn't a permanent thing. And who knows, it's a limited resource. There were some attempts at the state level to increase the benefit slightly, but it's not significant enough really for anyone to sustain a living, and especially not in Buncombe County. So I think the average benefit from the state, the last I saw, the average is around $246, $250 a week. And so I would really have an honest conversation with them about that. But I understand I understand it's a reality. and it's something you're dealing with, but hopefully it's a temporary thing, and hopefully you're able to find plenty of good people willing to work right now, especially with all the claims that have been filed recently.
I've seen a couple of questions about who's going to be actually reopening. I think from the town halls last week, the chamber put out a poll where we had, maybe they could share that graph at some point, but they had a response to how many people thought they'd open, at the start of phase 1 or different time frames. So I know that was a question from your guys' poll.
Yeah, we did a follow-up poll for those of you. A lot of people on this chat probably responded to that poll. We have a link to the dashboard on it, and it really talks more about relief funding to a large degree and barriers there. But I do believe we had questions on there about actually reopening. I'm trying to see if I can share that part of it. Desiree, if you have it, I don't know if you'd be willing to share it or not. But I don't remember the exact number off the top of my head, so I don't want to quote it. But I know that we did ask that that sort of similar question: if you're ready, if you're not ready, and then do you plan to reopen soon? There we go. Thank you, Aaron. So that link to that survey is in the chat now. Russ from Second Gear says he's planning to reopen tomorrow. That's good to hear. I know people are excited to get back outside. And Fletch, what about while we're on the subject of being outside, are the Buncombe County parks going to be open as of tomorrow?
Yeah, so we've over the last week or two, we've been slowly reopening a lot of parks. I think the city's looking at reopening some parks. I know this weekend some state and federal parks will be reopening. So a lot of stuff starting to reopen. But stuff that some of it will be closed for specific reasons. Either there's specific equipment there that gives us concern, or there's specific situations and choke points that give us concern. So I would say just check ahead where you plan on going, and just if a park is closed, please observe that. Don't sneak in. But there's gonna be a lot more open this weekend than there have been previously. I don't think it's gonna be a very nice weekend this weekend compared to last one, but we're slowly starting to open up the outdoor stuff. Can't speak to the Parkway yet.
Well, I was just going to say blueridgeparkway.org because it's sporadic. But if you go to their website, they actually have a map of what's closed and what's open. The last I checked, so I don't know if they've updated it for what's coming tomorrow, but I know that's always a good place to
look. I think dog parks, as those parks open, some of them might be open, but you just have to again check ahead online whether they're specifically open or not. It's for me, it's interesting to see the combination of people who from this informal poll will be opening this weekend, or how many people are going to wait a couple more weeks. Seems like a lot of people who are opening are going to open in a very reduced manner, trying to just do curbside stuff as much as possible.
Yeah, and I would share, I know I saw some questions earlier, and thank you guys for sharing about whether you're opening or not. This is good information for us to have. But while they're doing that, I wanted to, I'd be remiss if I didn't mention that we are going to compile a list of local resources specifically for the things that we were talking about earlier and put on that same resource page. So everyone be on the lookout for that. Some of it might already be on there, but I don't think it's completed yet. But we are compiling that list and going to put that on there. I know Noah was talking about that earlier, having sort of like a one-stop shop for local businesses who are supplying and need buying that kind of equipment. So it looks like a little bit of a mixed bag. A lot of people are going to try to open tomorrow. Some people are going to hold off for a couple more weeks. So it's interesting. It's about, I think, what the survey was kind of like. Again, make sure you adhere to the requirements. Obviously, you can go with the recommendations as well. And we hope that you do. But you have to at least meet the minimum requirements. And Fletcher, I don't know if there's any. Yeah. Is there a mechanism for enforcement on that businesses should expect? Will there be extra inspections, anything of that nature during this time?
For capacity?
For the minimum requirements that businesses have to abide by. It's
going to be complaint driven. So we'll just respond to that. Elizabeth Shell, I see you have some concerns about some other businesses. You've always been able to report somebody if you think they're not complying, and whether they might have been deemed essential at some point. But it's up to you. Like, you don't have to open. We're not forcing anyone to open. You can make the decision whether they're open or stay closed. Yeah, so I see Matt has a good question about medical privacy concerns when checking people's health status. The way we've crafted that survey tool, that screening symptom, is very deliberate, so we're not crossing any HIPAA lines, HIPAA type boundaries. So if you use that tool, you'll be fine in that regard. So that's kind of why we want to provide one. There's also a lot of other good resources for that online. So if you find another one you like better, feel free to use that. But you do have to do some kind of screening tool daily basis for employees.
And how should those complaints get lodged if another business wants to report that, Fletch?
We're encouraging people just to call local law enforcement for whatever your jurisdiction is on a non-emergency line. So you don't want people calling 911, but just
Right.
look at whether it's, Asheville Police, whether it's Black Mountain or Weaverville, wherever, just a non-emergency line, report that, and they'll follow up.
So just to give you an idea on the numbers, Fletcher, I've got the numbers here from Desiree from our survey. 35% of the businesses that we surveyed, and I think we had around close to 300 responses in about a week and a half's time. 35% say they have the resources they need and will reopen. 42% plan to open if they secure the needed resources. So I remember it being a little under 50%. So that sounds about right. It seems to be about where the chat seems to be kind of split in those same lines. So I'm not surprised by that. And again, I know it's uncertainty plus resource management, plus maybe even staffing concerns from a lot of people as well. I think that's pretty common right now.
Yeah, I see a question about like sidewalk use and like the 6 feet distance. So going back, just rehash that close contact criteria again. It's 6 feet for an extended period of time. So just walking past someone on the sidewalk is not significant concern, especially if we're wearing masks, as we're asking people to do. Where we start getting concerned is where you're within 6 feet of someone for 5 minutes, 10 minutes, like that, where you kind of sitting close together, and that's why that close contact criteria is those businesses aren't opening. Where you have a retail where you can circulate and people come in and make an exchange and leave, or can circulate through a store is one thing. Like a barbershop or a nail salon where you're sitting face to face with someone for 10, 20, 40 minutes, that's the difference. So walking past someone on the sidewalk as you're walking different directions, or you're overtaking someone, not as much of a concern, especially if you guys are wearing masks.
Matt asked a good question. I know the city and you guys have been talking a little bit about some street shutdowns and things of that nature for curbside pickup and pickup. Has there been progress made on that in the last week or so, Fletcher?
I don't know, but I'll take that specific question back, Matt. I know, I think the city's planning on not enforcing the parking for a while longer. But I'll ask that. Is that what is there a street specifically you're referring to? I know there's a couple of different things going on.
Yeah, I mean, they had the plan, Haywood, Page Avenue, all that stuff had been planned for a while prior to this and was going to be shut down some. Yeah, Haywood Street's what he's talking about. So a
Okay.
lot of that was planned, Matt. A lot of that was planned prior to this, but I'm sure they're trying to make accommodations to help folks out as much as possible.
Okay. I'll take that back to the city. Matt, thanks for that. Yeah, so I see Ann has something about temperatures. Yeah, there's specific guidance for what temperature would do, but the taking temperatures is not part of the screening we're pushing out. If you guys have resources to take someone's temperature and you can see if they have a fever, you can use that, but just the temperature is not going to be an effective screening tool. We know 50%, in some populations, up to 75% of the people who have COVID-19 never display a fever. So it's more important than somebody's temperature is to ask those symptomatic questions and feedback. So if you can take people's temperature, it's a tool to use, but more importantly than having somebody's temperature is going through those screening questions on a daily basis.
Hey,
I don't
Carl.
know how long the free street parking will be in effect. I could try to ask the city what their plans are for that.
And Carmen, yeah, that was more of an anecdotal thing. That wasn't scientific by any means. I'm just gauging based on what's been in the chat with folks saying that they're going to open or not. But I did give you the statistics on the survey that we did, certainly for that. Someone asked about Senate Bill 704. I think that's in reference to the bill that was passed that Senator Edwards introduced and was part of the COVID-19 Relief State Act. The Asheville CVB does have, I believe they're beginning to take their applications and they're going to run those through Mountain BizWorks. And this is a $5 million allocation that will give out $50,000 grants to tourism-related businesses, not lodging. So if you're a tourism-related business, you can apply. Mountain BizWorks has the information for that, and that's where you should go. And they do not open until May 15th. Thank you, Sharon.
Yeah.
Today.
Jenna Wilson brought up an interesting question. She's asking about enforcement at hotels and how a business can tell if somebody's from the area. So the one place that Buncombe County is still stricter than the state is that we are continuing a restriction on leisure travel bookings to Buncombe County outside Western North Carolina. And we did that Western North Carolina, we used the 828 area code. So what we're saying is if you're from an 828 area code, you can do leisure travel to Buncombe County, but you can't, if you're outside that, either farther east in the state or another state, you can't come in for leisure travel. We have good relationships with our hotels, our homestays, good channels of communication with them, and we're doing a town hall with them later today to talk through that. But they've been enforcing that. They've been asking, because we've had that in place, they question people as they make reservations, determine whether they were coming for essential purposes or not in there. So we're not asking business, retail, to determine whether somebody's from 828. People can always drive in for a day trip, because you don't even, I mean, I saw lots of comments about how many tourists are out downtown. I mean, how do you really know the tourists? Are they just people coming in from, so we're not asking retail to make any determination on that. We're asking hotels and lodging to do that to deter people coming in for leisure purposes.
And Ken, I see, thank you for joining us and being here today. Ken is the parking director for the city. He says the decision to start charging for parking has not been made yet. So
great.
So indefinitely for now. Do you have an answer for the 828 area code rule work there, Fletcher?
Yeah, so it's nothing to do with your phone number. It's your residence. If you're a resident of an 828 area code. So I have a 919 number. So we're not tying it to phone number. It's what their primary residence is, like a zip code, if it falls in the 828 area code.
Okay. I think we've pretty much run the gamut, it seems like, Fletcher. If we can go to the final page.
Let me, I see one more question I'll get from Zoe about if there's only one person working a day. That's fine.
Yeah, that was a good question.
Yeah.
Go for it. Are you going to answer the question about the one employee?
Oh yeah, so I'm sorry. I thought I did. I was saying that's fine if you have one employee.
Oh, okay.
They can do that screening.
Right. Yeah, I think that's actually a good way to do it. That seems to make a lot of sense to me. do you want to answer Patrick's question? Because I'm guessing there's a lot of, since we're so close to Tennessee, I know
Yeah.
they have different, I think they're actually a little bit more relaxed than we are, aren't they?
Yeah,
Uh,
so let me address that angle first. So we have no jurisdiction in Tennessee. We have no jurisdiction outside Buncombe County. So if you're doing those trips, you follow their guidance, but we just recommend you be smart and use best practices. Um, so you're saying some trips occur within a boat. 6 feet distance is almost impossible to meet. Um, So I wonder about the boat. I wonder if you guys are shuttling over there. Um, I have to think through that and work through that. But I think maybe if you could look at maybe not doing those boat trips and just doing like the guided ones where you could keep people at 6 feet distance, like shore fishing or like wading in. I don't know.
or have them drive separately. If you're used to
Yeah,
shuttling in big groups, say,
yeah,
guys,
Patrick.
I have to drive
Um,
separately, but once we get there, we'll work it out kind of thing.
yeah, Patrick, if you email, and any of you guys, if you have a specific question like that where maybe we need to think through a little bit more or you need some guidance, you can email business at Buncombe County. Oh, there it is on that slide. Sorry,
Right.
business at buncombecounty.org. And we'll work through those with you and try to figure out what we can do.
Yeah. So, my closing thoughts for today, Fletcher, and I'll feel free to cede the floor to you and let you say whatever you want to say in closing. But I really appreciate the feedback today and the engagement. I think this is the best one that we've had from that standpoint. I'd be interested to see the number of comments we had. So if you do have other thoughts, say we close out 10 minutes from now and you're sitting around drinking, eating lunch, you're like, oh man, I forgot that this was a great, something I should have asked. Go to business at buncombecounty.org and you can also always ask follow-up questions there. So make sure you write that down or have it stored somewhere. Again, we will be, this has been recorded and we will be putting it on our website at ashevillechamber.org/coronavirus. Not only can you find all of the webinars and town halls that we've done during this pandemic on there, you can also find links to the surveys that I mentioned. We've done legislative updates with legislators on there. We have a huge compilation of CDC guidelines and DHHS guidelines as well as county. So I encourage you to go on there, utilize that resource. And Fletch, I'll go ahead and let you share some closing thoughts. And I see we got a few last minute
Yeah,
things.
let me try to knock out a couple of the questions I saw just pop in.
Sure.
Miles, about hotel restrictions. So currently, hotels can book people coming for what we used to call essential business, coming for a task for that. The restriction we have on place is currently extended to May 22nd, that they can't take leisure travel bookings from outside the 828 area code. And that applies to homestays, B&Bs, hotels, motels. What we've told them is that starting at May 22nd, they can now start taking future bookings. So they could go ahead and book out past May 22nd for that, but they have to assume risk because state guidance may be extended or changed. Our guidance may be extended or changed, but that way they could at least start planning. We'll see what the data, so this is all data driven. This is all based on our metrics and our trends. But if things are looking good, we will probably late May allow them to open up for leisure tourism. If they're not, we may extend that restriction, farther into May. We just want to see. We have some time over the next couple of weeks to see what our trends look like as we go into phase one. We'll look at what the rest of the state does in phase one. We're also still keeping a close eye on Georgia, South Carolina, and Tennessee since they've kind of opened up faster and earlier than we did to see what kind of trends they're seeing, and that will also inform some of our decision making. So I see Mary or Marcy's asking about a communications campaign. We're pushing this locally. It's not public health's role, but I know I think the chamber and the TDA are making some plans about a local staycation kind of campaign about being local, supporting local business. So I think there's gears turning for that kind of strategic campaign. More questions about if 100% of your staff feel it's too safe, too risky to open, I'd recommend not opening. Sign ordinances. I'm I'm not familiar with sign ordinance. All right, so closing thoughts. I think seems like we have the whole spectrum of people who will be opening today, to some people who have a phased-in approach, or some people who are just kind of wait till phase 2, or saw some people not open for full operations planned until June. Public health is here to support you guys. We're aligning with governor guidance. Our intent is, to the greatest extent possible, continue to align with the governor as he moves through phase 1 and the phase 2 and phase 3. We do, and if we're focused on Buncombe County, so if some of those decisions in the future don't make sense, we're reserving the right to be more restrictive, maybe keep us at phase 1 longer if we feel like it's too soon for Buncombe County. So we're focused on Buncombe County. We're going to do what we think is best for residents and businesses in Buncombe County. But we are trying to align with the governor. We're here to support you guys. If there is guidance or gaps we can help you with, please send those emails to business. We'll review all the questions we didn't get to today. We'll just keep working on getting through this together. It's interesting and unique times we're living through. Appreciate you guys.
Yeah, and thank you so much, Fletcher. You've been very helpful through all these town halls, especially today. Thanks, everyone, for tuning in. We really appreciate you taking the time out of your busy schedules as you're trying to maybe get things ready if you are reopening, if you're still running your business. So thank you for taking the time to stay informed here today. We really appreciate it. Continue to put in your feedback in the chat feature. Continue to monitor our website as well as the county's website. Thank you to everyone for being here today. Please stay safe out there. Have a good weekend. We appreciate it. Bye-bye.